And with that, I'm going to turn it over to a discussion and talk to our Tina and Ravi. What's been your experience with vaccine hesitancy regarding influenza specifically, and any ways that you use to overcome it?
Two things that I get all the time is that, one, people say, well, I got the flu vaccine before and I got flu from it. So I don't want to give the flu vaccine to my child because I don't want them to get sick. And so there is a misunderstanding there about the fact that if you get an injectable flu vaccine, you cannot get influenza from it. And the other one that I get all the time is that I'm not at risk for it. So if I'm not at risk, then my child's not at risk, and I don't want to get him or her the vaccine. So I really think that there needs to be more education to the parents about the fact that your child and you are at risk for influenza, and that this is the best way to protect them against getting influenza.
I would build on what Tina said. I think the other thing that perhaps we could do better as providers when we communicate about flu vaccine is, I think people hear about sort of breakthrough cases or the idea that the flu vaccine in any given year might only be, 50% effective. And really understanding for people what that means. Yes, you might have a breakthrough case of flu, but we also know that studies have shown over and over again that if you are vaccinated, you're much less likely to become severely ill. And so there's the benefit of, yes, you might have had a breakthrough infection, but you're not likely to land in the hospital. You're not likely to land in the intensive care unit. And so you're certainly much less likely to die. Mm-hmm. And I think we often, people tend to think about vaccines in absolutes. It either works great or it doesn't. And I think we need to do a better job of explaining that it's not just about infection or not infection, but it's really our goals are preventing people from getting severely ill and trying to reduce the total number of cases. And I think we need to take responsibility for also trying to make that as clear as possible, not just for flu vaccine, but really for any of our vaccines.